Innovation, imagination, wonder. These are just some of the words used to describe Dr. Harvey Passes. Dr. Passes explores interesting people and ideas that will stimulate you. He questions the people who develop, create, and employ novel concepts in business and everyday lives. He especially loves to speak with successful people. How did they do it? How can you do it too? So let's join Dr. Harvey Passes in his quest of wonder and curiosity as we watch Dr. Harvey Passes Presents.
Today is going to be a great show. We are back. Yes, we're back discussing my first love. That's a pretty loaded statement, but my first love is dentistry. And it's hard to remember that I'm a dentist because I have guests on just being interviewed on various things, from the arts and medicine and business and law and chefs and wineries. But I love it when we come back to dentistry because I really get a kick out of that. It's a lot of fun for me. Now, I have a dental study group that we get a chance to meet once a month. And it's great fun being with my colleagues, and they come from all over the tri-state area, and we meet on Long Island, and we get a chance to share lots of things that we learned and help each other, and it's a great time. Well, one of the doctors who hails from Staten Island was at our meeting, and she's bright and articulate and lovely to look at, and we were discussing things, and she asked me about my TV show, and then while she was discussing some points that I found interesting, I said to her, how would you like to come on TV and discuss all that? And then she immediately said, are you kidding? I said, no, really. So I twisted her arm, and I got her to make the big trek from Staten Island, she's laughing, to come here, and you're going to meet now the illustrious Dr. Marcia Greene. Dr. Greene, Marcia.
Thank you for having me.
It's great to see you.
Thank you. It's wonderful to see you also.
I thought it would be great for you to come down and discuss various things. Let me just tell my viewer at home that, as I said, you hail from Staten Island, but yes. You went to Fairleigh Dickinson University School of Dentistry?
Yes, in New Jersey.
In New Jersey, right. And I don't think it exists anymore, does it?
No, unfortunately, we closed in 1990.
Yeah.
But our graduates are still out there doing wonderful things.
Right.
We're all over the world.
Drilling, filling, and billing, right?
Yes.
That's great. So now you've done many residencies in implantology, dental implantology,
yes.
And in periodontics. And in orthodontics.
In orthodontics.
Which is great.
Yes.
Terrific. Excellent. Now, when we had our meeting at our study club, we get together, you raised some interesting points, and I thought it would be interesting to have you come down so we can have a nice dialogue and discuss certain things that I know that my viewer would really appreciate hearing. Let's first talk about prenatal or early childhood dentistry and the things that expectant moms and moms
need to know.
should really know about. I mean, there's, well, the old saying, an apple a day keeps the doctor away.
Right.
Okay. How does that apply to
actually
dentistry?
Not such a false myth. There's some truth to it. What if you eat an apple a day, if you eat a vegetable or fruit diet, mainly fruits and vegetables, you're going to keep your body more healthy. It's going to be more towards an alkaline environment, as opposed to if you're eating more proteins and junk foods, you're going to be more acidic, and that's going to cause more inflammation and more disease in the body.
Okay.
Yeah.
Hold it. Let's go back to what you just said, because I want to make sure that my viewer gets this.
Right.
You're discussing the difference between something that you ingest
that's
in the body. Acidic or alkaline. And briefly, what does acidic and alkaline mean?
Right. On a pH, most people know about a pH scale and the litmus paper that you use.
Right.
On a pH scale or a litmus paper, anything below 7 is acidic. And the litmus paper would be tested red. Anything above 7 would be purple and would be more healthier for the body in terms of foods and the different foods, and we'll go through that.
Right. So things that are alkaline are healthier for you than acidic.
Right.
Okay. All right. So what eating an apple will foster alkalinity?
Yes, would actually make the body more healthy. But you need more than one apple.
I see. Yes. Okay. That's very interesting. Now, what about, I mean, you've heard, people have said this for
ages.
For millennia,
right.
that that with every pregnancy, you lose a tooth.
Right, that's not
Discuss it.
It's not just a false myth. That has to do with the amount of calcium that the baby takes from the mother. And in years ago, when women were having more children closer in succession, they would get pregnant. That baby takes a lot of calcium. It takes about 18 months to rebuild the original levels of calcium, which sustains the bones. So if you're having a baby every 9 months or every 10 months, you're losing calcium. Your body's not rebuilding
Not replenishing it.
And the jawbone, which maintains the teeth, become weak, and you lose the teeth.
Very
so
interesting.
with every pregnancy, they would lose a couple teeth,
Right.
and they wouldn't be replaced, so your dental health goes down the tubes. And women at that time would become more ill. After each pregnancy, they would become successfully more ill. They couldn't regain their health. So
Do you agree that during pregnancy, women naturally should get good cleaning 3 times?
they should
Once
have
every 3
regular
months?
checkup every 3 months. You can't do a lot of dentistry before I think 5 or 6 months.
Right.
You shouldn't have intensive dentistry, but certainly have preventive work done. And there is something called gingival pregnancy gingivitis.
Right.
So you want to prevent that as much as possible.
Right.
And that's eating a good diet and getting cleanings and maintaining good oral health.
Because I've seen it with my patients also, ladies who are pregnant, their gums become swollen sometimes and red.
inflamed.
And at worst, they become pus,
Right.
infectious.
And you have to really, the oral care at that point is critical because the body is more susceptible to infections, to inflammation. And the diet is critical. You have to, you should be eating a good balanced diet anyway, but critical for dental care. The oral cavity is the first portal of disease, and you get to see all that stuff.
Now, what precautions should an expectant mother take to help ensure healthy dental development of their going to be
Right.
their newborn?
They have to
the teeth?
maintain their own health, but also the medications they take. We know that tetracycline taken by the mother could affect the permanent teeth of the unborn child.
That's when you see all that terrible
This
dark
we see the
staining.
dark stains, and it's almost not impossible to whiten it when they become adults, but it's really devastating to the child when they're young and they have blue teeth in elementary school. It's really awful.
Oh, it's terrible for their self-esteem.
Right. So you want to make sure that the mother is taking in good nutrients to help that child, and also be careful with the medications. Always get your doctor's advice before you take medications to prevent that. And just like that.
Explain what is milk bottle syndrome.
In early childhood, before the 1 to 3 years old, the child, sometimes the mother will put the child to bed with a bottle, with formula, with high sugar content milk, or they'll put chocolate in the milk, and that would, without brushing the teeth afterwards. The child would sleep all night with this bottle, sucking on it, and by the time they get to the dentist, that child has all the anterior teeth, baby teeth, totally decayed, rotted to the core, and the child is uncomfortable, can't function. And it's devastating because that also affects the permanent teeth. If those baby teeth become infected, they prevent the succession of the permanent teeth coming in. And they also will stain the permanent teeth.
Right.
So that child at 5 or 6 years old, when they get new teeth, they think, oh, my teeth are going to be beautiful. They're brown.
It's terrible.
Right.
And what people really need to understand is that if you put the baby to bed with a bottle that's got milk or lots of sugar in it, even if it's fruit juice,
right, it's totally
the bacteria that normally live in the mouth, they're having a bar mitzvah in there. They're eating everything up.
Right, they're getting cavities way before they should, and you have to literally put that child to sleep to have the dental work done. It's traumatic for the child. It's totally unnecessary.
Can the dentist play any role in childhood obesity? And
Certainly,
if so, how?
Certainly. You're going to see those children mainly from 3 years old.
Right.
You can tell by the weight chart, by the height of the child, the dental development, what is going on, and you can alert the mom to say, look, this child is maybe a little bit overweight. You can work in conjunction with the pediatrician to make sure the child is on a good diet. And what I ask my parents to do is to watch the sugar content. That's first and foremost in childhood obesity. Sugar content, the snack foods. If the child is a little bit overweight, I say start watching what they're eating. Start making a note. Start forcing them to eat fruits. And maybe not vegetables so much, but pick your vegetables. Kids are not going to eat broccoli. Some of them are not going to eat broccoli. They're not going to eat sprouts. But pick maybe a salad. Get them into a salad. It's chic. You can make it colorful. And they'll start to eat and get to like salads, and it won't move towards chips and that kind of stuff. That's what.
You know how my
causes it.
wife got our boys to eat broccoli? Because they love it now.
Right.
She cooks it in olive oil and a little bit of garlic on it, all fresh.
Yeah.
And she cooks it al dente, so it's got
It has a crunch, right?
Crunch.
And you
the kids
always
love it.
and help them to help you prepare it.
Right. Absolutely.
If they snap their peas or snap something, and they're stirring. They all want to be emerald, okay?
Right.
So,
Right. That's right.
So, yeah.
Okay. So now the baby is born.
right.
What special attention should be given to the mother's dental condition?
The mother, like we said earlier, loses calcium, so the mother still needs to continue with her dentist to make sure that any gum disease may not be setting in that started during the pregnancy, that can be reversed, and make sure that she's taking proper vitamins in conjunction with her doctor to make sure that the calcium levels that she's lost are being restored, because that will propagate periodontal disease down the road.
So what I'm hearing from you is that, in your opinion, calcium is the single most important mineral that needs to be addressed.
Right, in pregnancy, yes, certainly. Certainly.
Okay,
Very
let's
high.
shift gears now.
Right.
Let's shift gears now, and let's talk about something that has social implications, and that's halitosis.
Big
or
halitosis.
bad breath,
Breath.
stinky breath.
Right, that's
okay?
worse than bad breath.
Right, well, the worst thing than bad breath is no breath.
Right.
But so halitosis. Let's discuss what it is and how does it impact on an individual socially.
Halitosis is one of those things that no one wants to talk about.
Right.
Husbands don't like to tell their wives don't want to tell the husbands, the boss doesn't want to tell someone that they have bad breath. But people have gotten fired. They've gotten divorced from bad breath.
Oh.
Not really because it's that bad, and someone may just not want to say they're embarrassed. The person who has it is embarrassed. The person who is impacted by the bad breath, if you work next to a coworker, it's really atrocious. It smells like sulfur. They don't want to tell you. They may say, well, here's my dentist number, or under the cover, go see this person. What I found that wives will bring the husbands in, or vice versa, doc, take care of her. And they won't say or him, just give him a cleaning. But that's usually not the only reason why a person has halitosis. It could be disease. It's caused by bacteria that produces sulfur. These people, it's actually disease. It's classified as a disease and needs to be treated differently than just a normal dental cleaning.
How could my viewer know if he or she has halitosis? What should they do about it?
Actually, significant other.
Say, do I have bad breath?
Yeah, is it that bad? Or we're not talking about regular, if you've eaten something, onions, garlic.
Right.
That
Right.
It's really something that's profusely bad, that you can, if you're sitting in a car, if you're sitting next to someone, you can smell it. So you want to maybe just do a breath test.
I know that you are very nutrition focused,
Right.
which is great. How does nutrition influence the disease of halitosis?
Halitosis is caused by high numbers of sulfur-producing bacteria. So in nutrition, what you want to do, if you want to work with halitosis from that angle, you want to have the patient change their diet to reflect, lower the carbohydrate amount of foods that they take in that are high in carbohydrates, high in protein. And like we said, move to a more plant-based diet, more oxygenating foods and waters, not carbonated sodas, that kind of stuff.
So are there other things that you could think of to prevent halitosis?
Most people who have it, there's a reason they have it, so you have to do other tests. You need their breath, there's a breathalyzer, literally like a breathalyzer that you can use to do and determine what bacteria are there, and then prescribe the appropriate antibiotics. And you want to change the microflora in the body. There's something called probiotics. So you may want to look at that, look at oxygenating mouth rinses, that kind of thing. The bacteria are usually anaerobic, which means they don't like oxygen. So you want to put stuff into the mouth that
will have oxygen.
So you're going to reduce the numbers.
I mean, you don't stick your nose in the patient's mouth and sniff away?
No. We have enough of that on a regular basis.
Absolutely.
We get splattered.
I remember, speaking about gross, I remember when I took endo at dental school, and I remember the professor, and this was a long time ago, taking a paper point, putting it in, and saying, "Now you got to smell it."
No.
And everyone looked at him like he was out of his mind because it stinks.
But that's how you tell the bacteria.
I know, but what a gross. Ugh.
That's actually a good way to test for halitosis.
Now, what about people saying, you know what, so I got halitosis, big deal, I'll take a mint.
It's not good. The mint has sugar. Most of them have sugar, and that's just going to make it will temporarily quell the condition, but it's going to just get worse.
What about using sugared gums or sugar-free gums?
It doesn't long term. It's not going to help. It will temporarily room, temporarily, you know. But it's hard to see it. There's some periodontal exception. But in most, it's around 50 to 100.
Now, this is an area that I love discussing.
Yes.
Talk about how science, and this is not new.
Right.
This is old stuff, but
right,
how science has finally linked periodontal disease to other diseases or systemic diseases of the body. What are some of those conditions? Carry them out.